Hello, everyone. Welcome to this free webinar presented by WePast. I'm your moderator, Cristina Ruiz. During this webinar, feel free to use the chat to ask your questions and discuss the topic. We will take time after the presentation during the Q&A to answer these. Throughout the webinar, we will stop the presentation to review. Look for the multiple choice review questions, which you will be able to answer in the polls section. Please go ahead and respond to these questions as they come up. You will have less than a minute to answer each one. This and other recorded webinars are available to WePast subscribers 24 hours a day, 7 days a week. Be sure to register through WePast.com to become a subscriber. Today's topic is titled Professional Ethics, How We Best Navigate the Small and Big Dilemmas in Ethical Decision-Making, presented by Dr. Alexander Brandl, Associate Professor in Health Physics and Associate Department Head for Research and Operations in the Environmental and Radiological Health Science Department at Colorado State University. Thank you for joining us, Dr. Brandl.
Thank you very much, Ms. Ruiz. Thank you for the kind invitation and for your kind introduction. Good afternoon or good evening, everyone. It's a pleasure and an honor, actually, to be with you tonight. I realize that ethics in general and professional ethics in particular might not be the most interesting topic for most of us. I have spent some time over the last few years thinking about those, however, because in the end, ethics or the thought or the study of ethics hopefully guides us in, as the title already says, in our decision making, especially when we face dilemmas as to whom to serve best and most and foremost. So hopefully that is something that is interesting to you in the end. I can only provide a very top-level overview in those 45 or 50 minutes that I have available today. I usually give an introduction in one of my courses, and I usually spend at least 2 hours and then some additional discussion with my students on that. But today, at least, we will try to do this in 45 minutes. I also realize that I might have provided a fairly large set of slides for a presentation that's only supposed to last those 45 or 50 minutes. I did it on purpose, though. I did want to provide as much information as possible to you and for you, especially in your studies for your exams, your board exams, which, as we will see here in the very beginning, the study of ethics and the topic of ethics is a part of the board exam. And hopefully by the end of the hour, you will understand why. So let me first introduce ethics in kind of a practical sense. And when I say that, I also need to immediately put a qualifier on that. And that is that even though various fields and specialties have their own codes of ethics, that they might not be as descriptive or as clear, especially in making our decisions in the course of dilemmas, as we sometimes might want them to be. And hopefully, again, my presentation today will give you some additional information on how to think about that. So we'll talk about the Code of Ethics by or for, or the one that the American College of Radiology uses in the very beginning. Then we'll look at the study of ethics, the historical background to ethical theories, and how that then translates into professional ethics and kind of the rights and responsibilities of professionals, and with that their professional conduct, and how we would view professional conduct and professionalism as a noun in our relationship with our patients, our clients, and or our employers, depending on who we work for and what our working environment is in most cases. So for the American Board of Radiology exam, we really want to see a large number of different topics. From ethical principles, the historical perspective, again, I want to provide some of that, the basic ethical values, when and under what circumstances we might encounter such dilemmas, and how to, for ourselves, decide which way to go in the course of those dilemmas. And that kind of naturally leads us into the discussion of relationships with others, our employers, our clients, and most importantly, especially in the clinical sense, with our patients. And you will find in any code of ethics, you will also find the necessity for continuing education. As fields of study, of practice, of specialty and specialization, our fields do not stop. And so once we're done with our studies, we do need to stay on top of what's going on in the field in order to provide that best care that our patients deserve. Especially in the medical field, the study of ethics has a very, very long history. In fact, probably the longest. And that started even, in Greek philosophy with the Hippocratic Oath. I realized that this is somewhat idiosyncratic in that it mostly ascertains or pertains to the study of Western philosophy. However, we have tried to look at other lines of thought as well, and realize that their general ethical principles are very similar to the Western thought as well. So that Hippocratic Oath in it by itself is not that unique, I guess, in its development and evolution. The ACR Code of Ethics has two major parts, or three, as we will see here in a second. First, the principle of ethics, and do not confuse those with basic ethical principles. This is really the goals for professional conduct, and with that, it's already applied to the conduct and behavior of professionals in the field of radiology or medical physics. And then the second part is specific rules of ethics, or are specific rules of ethics. And those, of course, are mandatory to all the members of the American College of Radiology. So in those principles, the first and foremost, and we'll come back to that on various occasions here tonight, this is the rendering service to people, to our patients. One, in the best interest of the patient, so the best possible care, and with full respect of human dignity. And I will try to define and explain those in a lot more detail as we go through tonight's presentation. Continuing education, we already touched on that, is one of those principles. If we're out of our expertise or our immediate field and line of expertise, it is not just right, but it is prudent and required of us to then understand our individual limitations and seek outside consultation, and or refer our patients to other specialists. And again, we will see this a little bit later in the presentation as well. Our responsibilities do extend to society in general, not just to an individual patient, especially during times of a pandemic, as we have these days. That is one of the pieces that we are responsible for as well. So not just our patient, but the health and the well-being of the community has to be in our mind and on our minds as well. And whenever we sign off on consultations, we publish. Of course, plagiarism is not appropriate in any line of work, and so of course in ours as well. And so the appropriate attribution of work is also one of those general principles. Now we come to the rules. So these are a little more descriptive and prescriptive for the members of the American College of Radiology. For individual behavior, I will use the term integrity frequently, and we will see that even though this term comes up in, well, almost any code of ethics that I'm aware of, that the definition of it, at least just in the code of ethics or in the rules of ethics, is not always all that clear. So I will spend some time on trying to explain it much better and in much more detail here tonight. In fact, I think this is my main emphasis of tonight's lecture. So for the individual behavior, in any case, we always wanted a very high standard. I'm not quite calling it the highest standard yet. And I will explain why that is the case as well, of ethical, legal, and professional conduct. We already talked about consultative opinions, to stay in our specialty, to make sure that our instruments, our measurements, our assessments are all done with the greatest care. And then, of course, our interpretation of images and whatever else is done with that greatest care and diligence as well. Especially if quality affects the safety of our patients in some places. And then, of course, when we leave the field of our specialty, then we provide the corresponding referrals. The rules of ethics in the ACR Code of Ethics here then has an extra bullet that talks about potential financial conflicts of interest. In case of referrals, please pay attention to that as well, especially self-referrals or referrals to your own group are sometimes frowned upon. In personal and professional interactions, of course, we always have to show respect for others and refrain from harassment and unfair discriminatory behavior. I think that should be self-explanatory, but did get another portion of, or in the rules of ethics. We ensure the provision of the necessary medical care, both cost-effective as well as of benefit to the patient. We need transparent billing policies, and we already talked about publications and the attribution of credit earlier. Now, of course, in our research, in our publications, the utmost integrity, again, that word, and honesty, of course, are important. And the ACR has a set of disciplinary procedures that they could involve in case of violation of those rules of ethics. I won't go through the details of those, anywhere from a letter of concern that the member might receive to eventual expulsion if that violation of the rules was really severe. The ACR has an ethics committee to deal with these kind of possible complaints against individual members. So here's our first question. Of what topics in professional ethics or ethical considerations does the ABR want members to be aware? A, ethical principles and values. B, potential conflicts of interest. C, professional relationships and professional conduct. D, the importance of continuing education. Or E, all of the above.
Okay, great. Thank you. This question is up in our polls section, so I see some folks already weighing in. We'll give everyone just another moment, if you haven't already, to answer this question. And also, if you have any questions for our Q&A at the end, please feel free to drop them in the chat and we'll go over them at the end of the presentation. All right, it looks like most folks are getting the correct answer on this one.
Yes, I was worried that my questions were too simple, which is good. There's a couple more. I'm just hoping to keep you entertained and keep you with me in your studies, and we'll go on. So this was kind of a general introduction to the code of ethics. And most of you might probably have read it and studied it. What I'm a little more interested in for tonight is just to give you a little bit of background first, and then kind of move into some of those dilemmas. It always looks reasonably simple on the code of ethics as to how to conduct our business and our patient care when there is no dilemma or no question as to whom to help first. We'll try to investigate this a little more. In the study of ethics, I realized that many times morals and ethics, or morality and ethics, are almost used interchangeably. And they come from the same basis, but I do want you to be aware that there's a subtle difference between them. So morality is something that we grew up with. It's good or bad behavior. I guess for most of us, it's our parents or our caretakers when we are younger. Then schools during our educational process. In our community, anything from employers to church to this is how we learn how to conduct ourselves, and what's right and what's wrong. Now, ethics kind of takes the bird's eye view of that behavior and thinks about it a little more, in that we're not just interested in what's the correct choice in any given question or problem or dilemma, but also how can we properly reason to get to that correct spot and to the correct decision. So historically, there's two main thoughts, two main streams of ethical theories, which we call teleological ethics and deontological ethics. The former one, teleological ethics, whatever is good is being examined on the consequence, on the outcome of the action. And if the outcome is good, well, then our decision was the right one and the correct one. Utilitarian ethics is one subdivision in these teleological ethics. In utilitarian ethics, we basically try to weigh possible outcomes, and the best possible one, well, that would be the correct decision. And so in teleological ethics, we're usually looking at a community of individuals and try to see which one of our decisions will make the largest group of these individuals, or will provide the best outcome for this group of individuals, or the largest group of individuals. Now, deontological ethics are a little bit different. In deontological ethics, we also view the individual as an end by themselves or to themselves. That means it's not just the outcome that counts, but are we treating the person, the individual within that community correctly as well? And let me give you a little example to this utilitarian principle or the principle of utility, where we just weigh positives and negatives, and that largest positive number, if we could define that such a number, would be the correct decision. The problem with that is, or some criticism that people always see with that, is that even if we serve the largest number of individuals, for certain individuals, that could actually be a bad outcome, or it could be immoral. And the example in the literature, although I do have better ones, and if we have time in the end, I'll be happy to discuss those more concrete examples in a little bit more detail as well. But the example in the literature is, say, it's the Middle Ages, and a village is being haunted by bandits. And in one of their raids, those bandits pose an ultimatum to the village and say they will raise the village unless the village gives them 3 virgins or women or whatever at their disposal. And if you think of the reason for that, why I bring this up is if you think of the largest number, or the largest possible outcome, possible positive outcome, of course, is that if the village stays intact and several dozens of people are unharmed, then in that case, the decision would be to turn over those individuals, right, to the bandits. Well, for those individuals, this is not a good outcome, and one might claim that in the end, the action itself is immoral. And so, even though utilitarianism comes fairly handy in many circumstances, one has to be careful with applying a teleological ethics unchecked and without much thought. The opposite then, deontology, that leads us to the categorical imperative by Kant. And here we do indeed look at individuals and the way individuals are treated by and through our actions. And the important piece here is that each individual in and by themselves have autonomy and should have freedoms to choose and determine their life plan, to realize their life plan, to determine their life actions. And only if we realize that and we allow that freedom and that autonomy to individuals, are we ethical people, and are we moral people and making ethical decisions. That's the best way of saying that. So let's think about this. So what 2 major sets of ethical theories are then recognized by ethicists? As A, I have traditionalism and dogmatism. As B, I have telemetry and optometry. As C, there is teleology and deontology. D, morals and ethics. And E, teleology and ontology. What do you think?
Okay, great. This question is up in our polls section. We'll just give everyone a moment to weigh in and see what they think the answer might be here. And just want to remind everyone, too, that any questions you might have, the chat is open for our Q&A at the end of the presentation. So please feel free to leave some questions there for Dr. Brandl. All right, it looks like this question is a little bit trickier. We have some different answers this time.
That's good. I meant for it to be that way. So.
Perfect. Well, I think we can go ahead and review the answer.
Let me go forward. So the answer here is teleology for ethical theories, is teleology and deontology. E, if that was an answer that you chose, I did that on purpose. I just misspelled teleology and deontology to make it a little more confusing, a little more difficult. Morals and ethics is an interesting response. It's certainly a logical response, but those two are not ethical theories. So remember a few slides back when I did introduce morals and ethics, I introduced them as definitions for, well, what we would call ethical, proper, correct, good behavior, and for us to decide between good and bad. Well, and that theories that would guide us in our thought process as to how to define good and bad, and to define good and bad and appropriate actions and decisions. Those are those ethical theories, and those indeed are the correct answer: C, teleology and deontology. Okay, so that was a historical and kind of general introduction to ethical theories. Now we want to apply those to the profession, a profession in general. It doesn't necessarily have to be, radiology or medical physics, at least not quite yet. And so in our application to the profession, we want to define or distinguish between the system. So what are our core ethical values, the ones that we want to portray or need to portray, it's not just a want, in our conduct with our clients, patients, employers, and how do we then apply those in principle, in general, as well as for particular examples. And so the system, that's our core ethical values. Usually we find 4 in most professions. The first and foremost being beneficence, and or non-maleficence. We do more good than harm, right? That's beneficence. Or the less controversial one here actually is non-maleficence, and that is that whatever we do does not harm the person, the individual that we're treating, that we're working with. Prudence, justice, and dignity. And dignity we've already heard and seen in previous slides. That definitely applies to the individual. And prudence and justice, I will come back here again in a second. And so in that system, our most important emphasis will have to be at the patient or towards the patient, and in the back of our minds, always the community as well. And then in our application, we use as a reference our professional code of ethics. Now, in the decision making, we will see, if you read that code of ethics carefully, that it doesn't really explain dilemmas all that well, and is not very specific in an example or in examples that we could use in our daily life. And so what we want to think about instead is, what is ethical professional conduct? And maybe, hopefully, that will guide us into those decisions. And what can we do as employed professionals? And I put this in quotation marks here because it really includes all sorts of professional services. As service already, the term service already indicates, we're working for somebody. We're responsible to the patient. If you have your own practice, you're still working for that patient, in that patient's interest. If that's not the case, if you're employed in the healthcare system, you have an employer, you have a supervisor. And even if you're a consultant, an independent consultant, the second you take out a consultation contract, that contract will, to some extent, specify who you're working for. And this is why I called them earlier, the people that we're responsible to: patients, employers, and clients. As a contractor, as a consultant, it would be a client who you're responsible to. So in any case, we are employed in one way or the other. I already mentioned earlier that codes of ethics are fairly ubiquitous. So they're not unique to the ACR. The example I have here is one that I've used in a previous presentation. It's from the National Radiation Protection Association. It doesn't matter much. What I really want to point out, and this is why I have these red circles, ellipses here, is that our buzzwords appear every time. Members need to conduct themselves with integrity. Well, again, we haven't quite defined yet what that means. Public welfare and safety are important. But then also in employment and consultation, our clients and our employers. You can easily see that there could be some dilemmas or some conflicting responsibilities and duties in these buzzwords already. And I'm fairly certain that this numbering here that you see in this particular code of ethics is not a ranking. So 1 does not stand above 2, above 3. So let's think about this a little more. I apologize. I'm hoping my slide will come up here. I guess I'm missing one. I apologize. I don't know what happened to that. It might have contained some animation. We'll go on to the next question instead. Which of the following is not a core ethical value? A, integrity. B, justice. C, beneficence or non-maleficence. D, dignity. And E, prudence. What do you think?
All right, great. Sorry about that last slide. I hope it wasn't the webinar interface. But yes, this question is up, and please feel free to answer. And just a reminder, we have the chat available. And maybe if you're open to it, Dr. Brando, I know we said we weren't going to use the speak feature, but since we have a core group here, maybe we could open that up during the Q&A and try that out.
I'd be happy to.
Okay, great. So perhaps if questions come up for you participants later on, we're going to open up the speak feature for Q&A. All right, so it looks like we have some
answers.
Yes,
we have a split answer. Well, I will show you what I perceive to be the correct answer, which is actually A, integrity. I saw that most of you chose either justice or dignity. Let's think about this for a second. The core ethical values, and I purposefully did not mention that earlier, are in our conduct of business, in our conduct of professional services towards the patient, employer, etc. Right? So B, C, D, and E, they kind of reflect actions towards somebody else. How we should and how we could and how we must really, to be ethical, conduct our business and our professional service towards the other person. Integrity, A, this is why it's not a core ethical value, that is ourselves. So this is us as a person. We need to display this integrity. And this integrity, of course, is displayed by, for example, always treating others with B, C, D, and E, with those core ethical values. But while this is a projection, so the correct answers, well, the answers to core ethical values are the projection towards others, while A is our behavior, I guess, in our relationship with those others. So this is why A was the correct answer in this case. In fact, that leads us right into our professional-patient relationship and how we find and show this integrity. Again, in any setting in our professional conduct, we usually in a contractual relationship with our patient, our employer. The reason why we have the jobs that we get, this is why we're professionals. I didn't mention this earlier. When I have more time, I usually go through a definition of what a professional is. And one of or some of the characteristics of professionals are that they have to go through rigorous education and training, and hopefully you realize that there's a difference between those. That we specialize in our field with focused study through continuing education, as I mentioned earlier, and that then we learn on the job. We learn our trade through, well, first years of study and then years of practice with mentors and through experience. Now, our employers or our patients, of course, do not have that particular expertise, and it's not something that can easily be obtained. And I guess that this is the big difference between a job and the profession. That it does take a long time. It does take rigorous study and practice, and so we are employed or we are consulted because we have that special knowledge, and we are asked to provide that additional knowledge and expertise to our patients and our employers. And with those, or with that knowledge, of course, comes responsibilities. And some are common to most, maybe all professions. I mentioned a couple times already the provision of competent care or work, right? No shoddy work. I guess we cannot have that as professionals. That we provide the basis for informed decisions. And in our professional-patient relationship, I'll come back to that again here in a second. And we maintain confidentiality, patient confidentiality, that we're honest, that we avoid conflicts of interest, right? We're not working for our own good or just for our own good, but really the patient is our prerogative and our main emphasis. And that collectively, as a community, we provide access to those services so that there's enough of us that patients actually can find a radiologist. Now, we could behave in various ways, and I realize that I'm running short on time, and so I won't go through the details. The agency model is one where the professional is working on behalf of the client or the patient. Often that could go into being called a hired gun. So maybe that's not the most prudent way of working with our patients. The opposite is paternalism. It's easy for us to kind of fall into a thought process where we understand our field, right? We've studied it for many, many years. We are the expert in that field, and we want our patient, our employer, our client to kind of think the way or make the decisions the way that we think they would be best for them, for the community, whatever it could be. But we must refrain from that because it's actually ethically unacceptable if we try to assume that part of or that role of being the decision maker. We're still just the consultant. We're still just the advisor, and we have to understand that. And so if we allow the patient or the employer their autonomy and their dignity, then we're there to advise them and help them in their decision making, but refrain from making that decision for them. I realize that sometimes when you think they should just make that decision, that this is hard for us. So what we call the proper professional-patient relationship in the end is a fiduciary relationship where we are their advisor, their consultant. We provide all the information that the patient or the client has to have in order to make the most appropriate and the best decision for them. And it has to be their decision. So what we are really mandated to do in that case is that we provide a set of alternative solutions, including the solution or including the no action solution. What if the person, the patient, the client chose not to take any additional action. And we prepare those alternative solutions, and we explain those alternative solutions with the pros and cons, advantages and disadvantages, and allow the the patient or the client in the end to make their informed decision in the process. And that is very important because if we are not able to enter in such a fiduciary professional-patient relationship, then the most important piece that in that relationship, trust between the patient and us cannot be established. So let's look at another question. Which of the following is a duty common to most professions? A, providing the patient employer with the basis for informed decisions. B, confidentiality. C, competent care. D, honesty. Or E, all of the above.
Okay, great. Thank you. This question is up in our polls section, so I encourage everyone to go ahead and take a look there and answer this question while it's live. It'll only be up for a few more moments, and then we'll be moving along here in the presentation. And just a reminder, any Q&A questions, we're going to open up the speak feature so you can ask your questions out loud, or if you feel more comfortable, you can put them in the chat. All right, looks like
that was an easy one.
I guess so.
Yes. So all the answers seem to be on the right track. Yes, of course. All of those are common duties for professionals. A, B, C, and D. And in those last few minutes, I want to go back one more time to professional conduct and professionalism, and how it, one, is established, and two, fits into this professional client, professional patient relationship. So if you give me just a few more minutes, I want to revisit that. The most important ingredient between us and our patients or our clients is trust. And I have I guess, maybe that might have been the earlier slide. One of the most important pieces here is that trust is very difficult to establish, but very easy to lose as well. And this is why we need to show our integrity throughout the process in our interactions with our patients and clients, basically all the time. And how do we do that? Well, again, in that we understand the work that we provide, that we do it diligently, and that we do it honestly, and with candor as well. So not just telling the truth, but also not withholding unpleasant information if that is necessary for the patient or client to understand what's going on. The patient can expect a few behaviors from us unconditionally. And that is one, and I come back to, this is one of the first principles in our principles or rules of ethics, that we will act and we will advise in their best interest. So we're working for them. That their information is handled with discretion, and that they receive fair and non-discriminatory treatment. And that we're loyal to them. So again, that we serve them first before any others, and any that includes us. So especially if we have other personal or might have other personal interests that they have to take backstage, and front stage is for the patient. If we cannot do that, then we have to recuse ourselves from that particular service. There's, of course, a limitation to that, and that is, I hope that's not as common in the medical field. But of course, if there's any illegal acts that patient or client wants of us, that we wouldn't do those. Now, dilemmas can come in if patient and public welfare are at stake at the same time, right? Which one should we serve first? And that can be a difficult question. It can be a difficult decision. And if we as the professional treating that particular patient or employer cannot resolve that question, then we might have to recuse ourselves from that particular service or that particular task. We could do this by conscientious objection. We could also do this by resignation, and that is always a way of if we cannot figure out or resolve the ethical question at hand, especially towards an employer, we might have to leave that job. Something that comes up, especially in the media frequently, could then be, or another action could be whistleblowing. I think it's an important, it's an ethical act or action, but it has to be thought through very, very, very carefully. I'll be happy to entertain, especially those last two questions in the chat or in the Q&A later, a little more, the resignation and whistleblowing. But I would like you to think about those very carefully before you do them. And there's ethical reasoning behind the fact that I'm a little bit hesitant to call them all good and necessary. If there's significant harm or significant danger to the community, that will be the only thing to do, and the most important thing, and the only right thing to do, I guess I'm going to call it. Okay, and so let me kind of conclude with at least the formal presentation with one final thought, and that's on integrity. I've used this word on various occasions in the course of tonight's session. Let me try to define it. Integrity is the sum of all virtuous behaviors that we as professionals can have, and it is striving for morally right action all the time, not just in our interaction with our patients and clients and employers, but even outside. You've probably heard the example that, the physician who gets caught on the weekend with a DUI, that's not the best example, right? So let's think about what integrity in general and professional integrity really means for an individual, and what it means to be a virtuous agent. And so let me close with a quote that I found very interesting and very, very fitting. While integrity is costly, a failure in integrity is infinitely more costly. And so I will move to my last question, to the last poll. Which of the following is ethically unacceptable in a patient-professional relationship? Loyalty, A. B, paternalism. C, clear communication. D, mutual trust and respect. Or E, candor. What do you think?
Okay, great. This is our last question here for the polls. So please go ahead and make sure to chime in with what you think the correct answer might be. And then we'll be opening it up for a little bit more discussion style and Q&A after this. So stick around for that portion if you have any questions for Dr. Brandl. And it looks like most folks are getting the correct answer.
That seems right. Yes. I will move my slides forward one more time and give it the correct answer, which of course is, as you've all recognized, paternalism. All the other ones, loyalty, clear communication, mutual trust and respect, and candor, of course, are important ingredients to this patient-professional relationship. And just before I open the chat, clear communication, I think, is the piece where we as professionals can have the most input and the most effect, if you want. Because in our fiduciary relationship with our patients and, yes, even our employer, the important thing is that we show them and we make sure they understand what the different options are that they have and that they are which are available to them, and that they can choose the right action for themselves. So that's how we avoid paternalism and allow for dignity and autonomy for our patients and clients. Okay, let's look at the chats.
Well, it looks like we haven't had anyone post any questions yet, but I did have something I noticed that you talked about non-discriminatory policies, and I was wondering if you could talk a little bit more about your experiences. I know I've read articles about especially women of color who are discriminated against in the medical profession, and what do you suggest doctors and students can do to help advocate for people of color?
Well, first of all, I think it's I want to extend that discussion or the question actually a little bit, if I may.
Sure.
Not just women of color, or people of color or women, or it really should apply to anyone in entering the profession as well as in being treated. And I realized that this is a touchy subject, maybe even a political subject, if you follow today's media, and I find it a pity, and I think it's almost a shame. No, it is a shame that we have to have those discussions. I think the first thing that we have to realize for us as professionals is to realize the problem, to realize the prevalence of the problem, the incidence of those occurrences, and to not use platitudes in trying to overcome them. Many of the problems are systemic in nature, and I think it would be prudent for us and necessary for us to look at that system very, very, very carefully and critically, and see how we can change the system that it offers the same access, the same opportunities for everyone, and that includes women, people of color, women of color, and in fact, I'm invited to moderate a town hall, a podium discussion later in September on exactly that topic as well. And I think that was a long answer to a short question. I apologize. The most important thing for us is to recognize that the problem persists and that it is present, and that it is on us to change it.
Thank you so much for answering that question so well. I think it's really important and relevant right now as we're trying to improve our systemic injustices, not just in the medical field, but also beyond. So I'm really grateful for your answer. And if nobody else has any questions, I will go ahead and close our webinar here. Thank you so much, Dr. Brandl, for presenting this webinar. And thank you all for joining us for this free event hosted by WePast. This webinar will be available on our YouTube channel. I posted it in the chat, but you can also go to our channel to find it there. And if you need to review this presentation, and be sure to join us for our next webinar on AAPM TG292 electronic brachytherapy dosimetry, presented by Dr. Wesley Culbertson on Wednesday, August 26th at noon Eastern Daylight Time. And this and other recorded webinars are always available to WePass subscribers 24 hours a day, 7 days a week. So be sure to register through wepass.com to become a subscriber. And for up-to-date information about upcoming webinars, be sure to follow WePass on Facebook, Twitter, and LinkedIn. And if you have a moment, please help us improve our future webinars by taking this short survey. Thanks again, Dr. Brandl, and have a good evening.
Thank you. You too. Have a good evening. Have a good night.
Bye-bye.
Bye-bye.